The weather is heating up, and to beat the heat, a lot of people are showing a lot more skin, especially around the pool or beach. Now, for those who struggle with their body image, this time of year can be difficult. To discuss the growing issues with body insecurity, I'm talking to psychologist at UTHealth Houston, Dr. Andrea Taylor. Good morning, Dr. Taylor. Thanks so much for joining me.
Good morning, Haley. Thanks for having me.
So first, explain to our viewers, what is body dysmorphia?
Well, body dysmorphia or body dysmorphic disorder is an actual condition in which someone is particularly preoccupied with body image, but particularly a perception of some sort of flaw in their body that other people may not even notice at all. Or if they saw it, it would be very slight, but it becomes a preoccupation. And there are a lot of associated behaviors with it, sometimes avoidance, sometimes checking things. And true body dysmorphia only occurs in about 2% of the population, but many of the rest of us often have a lot of just self-consciousness about our bodies.
Yeah, I'm surprised that you say 2%, because I was actually about to ask you, how common is it, thinking that, like, I feel like I've heard of this a lot. So really, to some extent, do a lot of people have a little degree of body dysmorphia?
I would say a lot of people have a degree or degrees of extreme self-consciousness, especially about body and body image. Body dysmorphia gets to a point where it's truly preoccupying. People are engaging in behaviors, for example, a lot of checking behaviors, going to the mirror a lot. They even may engage in a lot of surgical procedures. So, for example, feeling like their ears are too big, always trying to cover them, or having surgical procedure after surgical procedure. I would say for the average person, it's more that extreme self-consciousness and this idea that that we look much worse than we do, or that people are focused on us more than they actually are.
So what causes this? I mean, is this something that you see commonly in girls? And I mean, I'm sure it's been around a lot longer than social media has been around.
It definitely has. For true body dysmorphic disorder, the risk factors include, for example, being bullied as a child, but also neglect and trauma. We also know that in true body dysmorphic disorder, there is a genetic piece that if someone has a family member with obsessive compulsive disorder, there's a higher risk. But again, I would think that, and it does affect men and women equally, but for this extreme self-consciousness that we see, especially in the summer, I call the summer the season of shorts, swimsuits, and short sleeves. And so we're more exposed in many ways. People can't hide quite as much. I think for that, we tend to see, again, both men and women, but in different ways. For men, it may be concern about muscles, and how their muscles look, or even hair, and receding hairline.
So interesting. You mentioned that we actually are going to talk about men in the next hour, in the 8 o'clock hour, but specifically looking at women and young girls. Is there some kind of talk that we should maybe be avoiding around girls that would maybe prevent something like this?
Absolutely. I think it's really important because we know a lot of this starts right around 12, 13, the early teen years. So I think it's important that we normalize what bodies look like. I remember even doing this with my son when he was little at the pool, saying like, this is what normal bodies look like, not just what's in the magazines or not just what's on television, but really normalizing what bodies look like and that we're all unique, that we're all special. But I think sometimes helping people, if they're struggling, understand that their bodies are okay, and certainly not overemphasizing things or being critical, body image, weight, appearance. I think the other important talk to have these days is about social media and the impact of social media. And what we see are often the airbrushed images or what people post. Now, that's the 1% of what they look like. Nobody looks wonderful in the morning when they wake up, and that's normal. So I think normalizing what bodies look like is really helpful.
So if you do start to notice some of these signs in someone you love or in yourself, what should you do? I mean, does everybody need to seek help for feeling this way?
Not everybody. I think there's some normal degree of self-consciousness, as long as it's not interfering or stopping what you're doing or preoccupying too much of your time. If, however, it's reaching that point, it's causing a lot of negative impact in your behaviors, you're not doing things that you otherwise would want to do, or it seems a major concern, it's causing things like other depression or anxiety, absolutely there's help. The best help for body dysmorphic disorder is cognitive behavioral therapy, often along with medications.
Dr. Andrea Taylor, before I let you go, we are going into the summer months. Whenever you hear that phrase all the time, getting, my beach body ready or getting swimsuit ready, what advice do you have for people as we move into those summer months?
I would say that the beach body is any body. Keep in mind what we're there to do. When we go to the beach, we're there to enjoy the ocean or spend time with friends. And again, everybody is a normal body, and we all have things that we're concerned about. So go enjoy what you're there to do, be with friends, enjoy the ocean, enjoy the pool. But again, if it gets too interfering, seek some help.
Dr. Andrea Taylor, I could just praise you right now and cheer for you. That is wonderful advice. And yes, no need to be out there at the pool critiquing other people, be showing the example that everybody is different. We appreciate your time this morning.
Thanks again.